Okay, thank you. So I just repeat, biosecurity is my passion because that's where everything starts. Very important, biosecurity. We farm with soil, grass, and what we plant. Genetics, very important. Parasite control, disease control, and then of course it's the jockey that rides the horse. I suggest that you also draw a circle with your farmer and talk with him or her through this whole process. And under each of these headings, write down what is important on that farm. But in the middle, this is where you dream what you're going to achieve. Put some nice photos of what you want to achieve on the ceiling when you lie on the bed. Dream. Keep on dreaming. And look at everything that can influence your farming. Nutritional deficiency, droughts, this whole thing about stress, overpopulation and stagnation brings in problems. Just think about a feedlot. If you don't know what you're doing, you're going to run into deep trouble. What diseases are attacking you? Parasites, poor management. So I'm talking about, in English, the 3 F's. Your farm gate, your fences, and what you think, your foresight, your brain. Afrikaans, hekke, heininge, and your harsings. Let's talk about farm gate and biosecurity. You've got control over who are going to come onto your farm. This is a very nice farm outside Bronkhorstspruit. There's this motor that can only be opened by the owner or the manager. So nobody is allowed on the farm if there's no appointment or whether they know who is coming in. And there are also the pictures being taken, and you can see exactly who is visiting you. Just another picture, different pictures, parking, not onto the farm, just next door or in a camp. Very important. You are the owner. You prevent diseases coming onto the farm. Speak to the manager before progressing past this point. No entry. This is at Sarnik, back and close here, sector, foot and mouth disease controlled access zone, disinfection of vehicles, disinfection. Everything is written in the book. Visiting the farm. There are a few pictures of gates, open gate, next door neighbor, maybe have some diseases like brucellosis or trichomoniasis. Are your fences intact? Let's think about communal farming. Does the community have a fence around the communal area? And then this photograph depicts exactly what I mean about harsings and foresight. The owner and his workers must be trained to have eyes behind their back, to know exactly what's happening on the farm, to know what's happening with water sources, about feeding troughs, about wires, about gates, knowing exactly when an animal is sick, showing clinical signs. So, dairy farming. When farming with a dairy herd, you are exposed to risk on a daily basis. What are the risk factors? Risk of disease, losses. It's all about economics. And a disease in a herd can undo years of hard work and cause financial ruin. So what is biosecurity? I think it is common sense. Bio, life, security, secure life. So it's a system of management practices used to prevent the entry of disease-causing agents. Now then we come again to your gate. Do you know what is coming through your gate? What is biocontainment? That's a system of management practices used to prevent the spread of disease between groups of the animals on a farm. And it's not only the dairy farm, it's beef or even game. So both measures are necessary to reduce the potential impacts of a disease outbreak. So there's a list where the problem comes onto the farm. Introducing new animals to the operation. Do you know exactly where and what happens on the farm from where the animals come? Isolating these new animals when they come on the farm. Quarantine camp, very, very, very important. And then designing a strategic immunization program, vaccines, preventing the diseases. And then in the case of a dairy farm, sanitation practices, milking procedures, disinfection of equipment, manure management. So you've got to recognize and understanding all the aspects of potential biosecurity breaches are essential to managing a successful biosecurity program. You've got to know every day, every minute, what is happening on your farm. So why is biosecurity important in South Africa? Infectious diseases, we're talking about what's happening at the moment with our foot and mouth disease. It can have a devastating impact on the productivity of any dairy operation. Every disease, virtually every disease, results in productivity losses. Milk production and quality can decrease, resulting in immediate financial consequences. Yeah, you can farm for the love of it, but you will not farm long. So what is the state of biosecurity in South Africa? The regulatory framework, biosecurity practices, and there's our country. Who is responsible for what? We often hear from farmers to say, yeah, it's the government that's got to look after it. A list of controlled diseases should be controlled according to law by the state. So there's a whole list, and I'm not going through every one. It's available on the National Animal Health Forum website, www.nahf.co.za, and click on Info Center. By the way, this presentation will be available for you. Just ask the MPO, Helena. So there's the link. And there you will see on the National Animal Health Forum all the controlled animal diseases. And there they are. You can read through them. Our important ones, brucellosis, Nagana, rinderpest. There are some, because a lot of farmers also have sheep. Notifiable diseases. If you have an outbreak, you've got to notify the state veterinarian. Do we do it for lumpy skin disease? Do we do it for blue tongue? I don't think so. Now, just you must know about the veterinary strategy. It's available on the National Animal Health Forum. And there's our chairman, Gerard Schutte, and the manager, Mrs. Mazan Roots, doing excellent work. Who our members. I'll come to that. And here is the conclusion and recommendations of the Animal Health Forum. We're now in the medium term, 3 to 5 years down, and there's the long term. And we've got to work all together to achieve this. And this is one of the most important things to restore the national chain of command from, as we say, DARL, DAF. So the structure has to change, that the head office are in charge. And at the moment, all provinces actually are on their own. And DARL is actually should do the strategy. They're doing it, but is it enforced onto the provinces? You know about the pilot project for brucellosis control? We used to have it, that our private veterinarians were in a model, but we've got to regain this whole program for brucellosis. The Single Veterinary Act, our laboratory capacity, we've got problems in certain provinces still. And then we have to have the LIT system, livestock identification and traceability, that we know where each animal is. And then the welfare issue. Prof. Gareth Bath plays a big role in this. So there are individual farms. Who's responsible for that? We've got to work with the state. You, the owner of the farm, must know what's happening with your neighbor, because it's no use. You've got your disease control going, but your farmer doesn't vaccinate for brucellosis, or their gates are open. We have this big foot and mouth disease outbreak in Potchefstroom area, where the outbreak had been on a single farm. The neighbors got infected, and now it's just running out of control. So the regulatory framework, we've got the immunity level of animals plus the infectious agent, and then we've got the environment, all playing a role. Immunity level, very, very important. And if one of these are out of order, we're going to have disease outbreaks. No farm is without disease at any point in time. So the key is to manage the infectious agents, to reduce or eliminate the effects on the health of a dairy herd through biosecurity and strict protocols. So you've got to know, I'm going to just discuss these: disease familiarity, information sources, bringing in new animals, contact with wildlife, your employees and visitors, a huge problem, bringing in pathogens on their clothes and on their boots, immunization, disease conditions, and mortality. So we've got to have basic knowledge of all diseases. And this is where the veterinarian, or the state veterinarian, private, state animal health technicians, farmers, and everybody got to know the basic knowledge of the disease. So many producers seem to be fairly knowledgeable or know some basics about anthrax, botulism, brucellosis, and mastitis in general. But the majority of producers were unfamiliar with BVD, Jones, and mycoplasma, and even more. So most producers use their private veterinarian for disease information. Similarly, most producers would contact their veterinarian if they suspected that an animal disease was on their operation. This is a fact. The fact that producers would first turn to their veterinarian, highlighting the continuing need to educate veterinary practitioners on animal diseases and provide training on how to handle animals suspected of having such animal disease. Now, the National Animal Health Forum, Marzani is sitting there, all producer organizations and more are all part of the National Animal Health Forum. And we really have got to work together. And if you go to the National Animal Health Forum website, www.nahf, you will see how closely the National Animal Health Forum works with the government, and also help to get strategies for brucellosis, for foot and mouth disease, and all other diseases. There's the website. And if you click on Info Center, you will see all the diseases, and under this you'll find information about how to control these diseases and actually what we're doing to control the diseases. Our RUVASA website, if you go to Info Center, remember that's www.ruvasa.co.za. Please visit this. You'll also find epidemiology reports from the Western Province, Gauteng, abattoirs reports, and these controlled and notifiable diseases. But please go to disease reporting. You'll find reports from really, if you scroll down, I think it's 2013, and each month, you will see throughout the country practitioners, state veterinarians, and veterinary laboratories report on what they have seen in their practice areas. And we are using the system, the VData system from VNet, Dr. Dani Oerendal. Go and visit this and see what is happening. And if you haven't registered yet as a veterinarian, contact Dani Oerendal or myself, Frikkie Bekus, so that you can get on the system. And that's the system that we use. And there are some contact details. Then there's the list of all the veterinarians' practices in the provinces. And these reports go to the agricultural media, and also a quarterly report goes to FearPlus. And this is just the report of Brucella abortus, brucellosis. You'll see the red, that's more than 10 cases. This is the orange. And you see each practice is there. And this is the average for all the practices. And the yellow will be one case, and the orange 3, here it's written 2 is more than one case, but less than 10. See the 2. So, new additions. This is really the big problem. Bringing animals without knowing their disease status onto the farm. And it happens again and again and again. Dangerous place to buy animals if you don't know where they come from and what their disease status is. Just bringing in one animal with brucellosis or one animal with foot and mouth disease, you can have immense problems. These vehicles, where do they come from? Where do they going? Disinfection of the vehicle. So, biosecurity rules for livestock agents, the APAC rules have been gazetted. So go to this publication, and it's on the National Animal Health Forum website. Here's going to www.APAC, Agricultural Produce Agents Council, and there is the law. And this is the rules that are set out. And if you go to livestock agents, click on the biosecurity rules in respect of livestock agents. Animal Diseases Act is there. So here you will see biosecurity at auctions cannot be 100% foolproof, but we have got to reduce the risk and spread of disease through biosecurity, disease surveillance on the farms. And that's where the veterinarian should at least come onto the farm once a year. All animals moved to an auction facility must be accompanied by original animal owner health attestation. Livestock agents must ensure that an original animal health attestation accompanies all livestock before animals can be moved to the auction facilities. Only animals that comply with the original animal health attestation may be offloaded at the auction facilities by Secure. And this is also important. It's a long list. No animals may be accepted by the livestock agent when not registered with the livestock agent at least 1 day prior to the auction taking place. Buyers, it's your money, should demand a vendor's declaration. Ask the farmer, has he tested? Has he got a brucellosis clear certificate? Have they mouthed the animals for foot and mouth disease? And I know there are a lot of animals that may be positive, incubation period. That's why when buying an animal at an auction, it goes to your quarantine camp, at least 28 days. Contact with wildlife. I'll just show you the chart for 2021 for bovine malignant catarrh snort sickte. It's all over the country. Just to remind you how snort sickte looks like. Now, what about the employees and the visitors? They can introduce disease agents via their boots, clothing, vehicles. And if I think about dairies, I think about cryptosporidiosis. Where did it come from? Maybe in the water. But if you go through a lot of our small towns, you'll see sewage running down the street. People travel. So please, don't just allow people on your farm going to see your calves or walking through areas where your cattle are. Just to show you again, that driver, where did he walk? Is he coming onto your farm? Is he having free areas just to go wherever he wants to? I mean, our veterinarians, we can spread diseases. Do they supply you with gumboots on the farm? The whole thing about immunization, I think Donnie is talking tomorrow also about vaccination programs. But last time we looked at heifer vaccinations with brucellosis, strain 19, RB51, about 17% of heifers had been vaccinated. In dairies, it's better. But what is your neighbor doing? What is the area doing? What is our country doing? The highest percentage of vaccine administered to heifers and cows were primary for viral respiratory disease. Three most common diseases in dairy cattle, according to producers, were clinical mastitis, lameness and fertility problems. So in addition, these diseases conditions accounted for the majority of cows permanently removed from the herd, about 1/3 of cow deaths. Lameness, fertility problems, that could be brucellosis, mastitis. So animal deaths represent the least desirable health outcome. Once a death has occurred, determining cause is important. Postmortems, contact with your veterinarian in preventing future death and improving the health of the herd. What do many farmers do? Contact their neighbors. Contact the co-op guy behind the shelves. Have a good relationship with your veterinarian. This can happen. This can happen. This was botulism. Just a dead rat in a water trough. Or those big silage or bales, a dead snake or a baboon in a water reservoir. This was lightning. So this module, the book, I haven't bought a copy, it is in the other room. Contact the MPO for the training module. It's a 3-day course that you go through everything. So what is the risk in the dairy sector? We've got a business risk, animal health risk, animal welfare risk, biosecurity risk, environmental risk. Where does your water come from? The river flowing through your farm. What happens higher up? Is this maybe near these power stations with the sulfur emission? Food safety, occupational health, public health. So the key components of the animal health risk management system include our national border controls, national policy, state-based animal health legislation, local monitoring of herd health with expertise, on-farm food safety programs, being able to detect, treat and prevent disease, surveillance, verifying the systems. So other risks, pre-farm, animal health risks, on-farm health risks, risks with transport, risk associated with manufacturing and processing. Your product going out, what happened to the swine industry when they had the outbreak of listeriosis? Can you think of other examples? And then the whole thing with animal welfare. People buying our products, they want to know that the animals are treated well, but that the product is safe. So there are a few where we have, through our LWCC, Professor Garabath, that they have a whole lot of SANS modules in place about calf management, tail docking, disbudding, lameness, and active steps to limit the impact of welfare from mastitis, heat stress, painful husbandry procedures, and downer cows. So dairy farm biosecurity in South Africa is not well established compared to other industries. Every participant in the dairy supply chain, the farm worker, should contribute to biosecurity. Active surveillance and mandatory traceability systems. Okay, we define biosecurity. I just want to come to this. Our water sources. Terrible what's happening. There are power stations. Environmental risks, water effluents, carbon tax, droughts. This, what happened just when a water were drilled deeper and they got fluor. Just look at what happened. This farmer went bankrupt. Storms, droughts, the whole thing about mastitis, cost of disease. See, my time is running out a bit, so I'm going a bit fast. This will be available for you. So your disease control programs, increase productivity and your costs. Drugs, vaccines, that's what your costs are. BVD, depressing the immune system. If you have that on the farm, loss in milk production, reduced conception, respiratory disease, mortalities, fetal losses. Test your animals. Know what's happening on your farm. So, animals, people, and programs. Biosecurity is the sum of management plans. And you have to have a plan. Draw up the plan with your veterinarian. I'm going to pass this. So, disease reporting, I've shown you. Isolating new animals, testing the disease. And there are the minimum tests, CA, TB, BVD, zoonotic bovine lycosis, Jones disease, and verify your vaccination program. So isolate animals coming in. I'm going past this. So testing for disease, your essential tests, and this is your optional tests. You can go through this. Just want to come to the diseases that you just see what's happening. Colostrum, absolutely the start of a disease-free animal. Anyone can spread disease. People, you can go and read through this. Okay, first, the calf protection, your replacement stock, and then the adult herd. Developing the immunization program, compulsory vaccines, and then essential vaccines, your respiratory vaccines, Clostridia, Rift Valley fever, lumpy skin, and then your optional vaccines. Neil Fourie is going to talk about red water, anaplasmosis. So bovine brucellosis, our big problem. This is what our country looks like. That was 2016 to 2020. This is now my disease reporting that I get. Brucellosis. Trojan horse. That animal that you buy in, the heifer, only testing positive after she's calved. Beware. Anthrax, respiratory disease, pneumonia, all over the country. Disease reporting 2021. Blackwater. There are the reports. Red gut, especially in dairies and feedlots. Botulism can happen anywhere, anytime. Rift Valley fever, we're waiting for it. It's going to happen again. Are you vaccinating your animals? Tetanus, your young animals. Lumpy skin all over the country. Red water. You bring in animals from areas where they haven't got red water, bringing it in African red water. There's your ASIC react red water all over the country. Anaplasmosis. Flies, just something on flies. This has been on a dairy. There's the life cycle. So you'll have this presentation. You can go through it. Adult 3 to 4 weeks. About Busca domestica and Tomoxys calcitrans. Here are the eggs, the larvae, the pupa. Just look at this. This is just on a dairy farm. And this is where we use these small little wasps. So places where there are mud, some farmers use these membranes, cloths that's impregnated with pyrethroids. There's some work that had been done to show the impact of flies on dairy production, the losses. These are the diseases transmitted by flies, fly worry as well. Fly control, pyrethroids, you get the fly bait, dispersible paint, ceromazine. Please visit this website of BISA, Bioinsectary South Africa, where you bring these small little parasitoids. This is a small little fly, a wasp that goes for the pupa. So you buy in a infected pupa and you can spread it around or put it in a container like this. So they will fly out and go to your dung heap and they will parasitize the pupa of the flies. I went to a feedlot and I had absolutely no flies there, no flies. So you can just go and have a look how this program works. 3-day stiff sickness, big problem all over the country with a lot of rain that we had. Other diseases of importance, venereal diseases, Trichomonas vibriosus. This is trichomoniasis, big, huge problem. And you have the Trichomonas going into the crypts on the penis, younger bull, Vibrio all over, TB, coccidiosis, huge problem, crypto, huge problem. Speak to your veterinarian. EBL, especially along the coast, but even it's in the Free State and we found it in the Northwest. At the RUVASA Congress, we spoke about it, and the problem is also that I think from Malmesbury, we heard that some of the farmers' wives had cancer of the breasts. Test your farm. 1/100th of a drop of blood can transmit the disease, transmit it. Then we could get these cancerous, terrible lymphocytomas, E. coli, and then foot and mouth disease. Just showing you the photos. It's also on the National Animal Health Forum website. And it was spread from the Vembe district, illegal transport. And this is where we all must be involved. And it's broken out in big feedlots, and we've lost our certification from the OIE. So we have got problems. Liver fluke, blue ticks all over the country, and we've got resistant blue ticks as well. So Donnie will talk about developing an immunization program, many vaccines. Speak to your veterinarian. You are veterinarians. Know exactly what's happening in your area. And then there's this whole management program. Contact the MPO. They have a beautiful, can you just bring me those books? I just want to show it. So assessment of your biosecurity status. And this is where you come in. We've got to preach to the farmer that biosecurity affects us all. Our export status, the income of the farmer. No farmer wants to put everything in place. And I'm just showing you these books. And they're available when you are going onto the course with the MPO. It's not so very clear, but it's a fantastic book with everything that we've discussed now that is available. And there's an implementation plan that you go through with your farmers, and it covers everything. And this is what I preach. And there's an absolutely good book about foot and mouth disease that Gavin Thompson wrote. It's something that you must really get hold of. It's there from AfriVet, through AfriVet. So biosecurity starts that we've got to train people. Train your farmer. We move animals. And I haven't even talked about resistant wireworm, resistant blue ticks. You buy in your problems. Quarantine. I can't emphasize anymore. So you can go and read this. Please get this presentation. Keeping infectious diseases off my farm. Strategic vaccination. Calf management. Biosecurity includes testing. You as dairy veterinarians, you are testing for brucellosis. But what happens on your neighbor's farm? Get your neighbor in as well, and then you'll get your area as well. Your equipment sanitation. So I'm going to stop here that we have a few questions. If you want to add something, we've all got to help that we can regain our foot and mouth disease-free status so that we can export again. And brucellosis, go and read. It's also on the National Animal Health Forum website about France bunting that got brucellosis. You don't want that disease. So if you drink unpasteurized milk, make sure that that farm has tested negative for brucellosis. Thank you for having this occasion to talk to you. I want to clone myself. You are my ambassadors. Thank you.
So I see there is a few questions. I see Luke's hand is up, so perhaps he can just unmute himself and yeah, ask you the question.
Good morning, Dr. Faffa. Good morning, Mrs. Olberholzer. How are you this morning?
Fighting fit.
Good to hear, sir. Good to hear. So I just have a few questions. I noticed that National Animal Health Forum is looking to control brucellosis. And one of the methods is suggested, especially with your calves, that to prevent the transfer, that 2 years where they only get, once she gives birth again, then she becomes infectious. There's suggested that those heifers and their calves get sent to a feedlot, specifically for brucellosis calves, during yesterday's presentation with Dr. Alicia Kluter. Is there anyone spearheading this at the National Animal Health Forum or this type of control? The National Animal Health Forum I can speak with?
There is a brucellosis steering committee. Chris van Dijk is the chairman, and Alicia is very active there.
Okay.
The problem that I see at the moment is that this foot and mouth disease, swine fever, and our poultry problem as well. So that we're just running around trying to absolutely fight fires. So yeah, it's going slowly, but yes, it is addressed. So I think it's that we have got to tell our people this, it's marketing. This whole thing about vets, vaccination, education, testing, slaughter. And this is part of it, what you have mentioned. So there are people that are active, but we've got to do more. How do we get it to the farmer? And that's where the private and the state veterinarians should work together at the Provincial Animal Health Forum and spread the news, exactly what you are saying.
Thank you, Doctor. And then, Doctor, just one more thing with regards to the biosecurity. I've noticed that a lot of farmers are starting to use drones now for biosecurity, monitoring who's coming onto the farm, using also the thermal side of the biosecurity, thermal imaging to see which animals are sick and which animals are now at a healthy temperature. Do you have any comments on that, Doctor?
Yeah, this is where we're going. But this system, you still have farmers saying, if we are part of this, then the government will know now how many animals I have and SARS and everything like that. We're doing this for our own, and it's going to cost money. And now we must think about people that haven't got the money. Yeah, it's an individual thing, and we can't wait till everybody is in the system. You can think about communal farmers. We just have got to start, and especially the dairies, they are far ahead of, say, the beef farmers. And Dani will probably tomorrow talk about his program with the veterinarians, and each farm having one veterinarian that vouch for biosecurity. But the farmer has got to start with biosecurity. So yeah, we've got all these new tags and things about that you can know what the temperature of the animal is. It's coming. Robotics, everything, it's there, but it costs money.
Thank you very much, Doctor. Have a blessed day further, Doctor and Ms. Olbolzer.
I see there is a few questions in the chat box. Corinne asked, so she said, good morning, Doctor. What practices have been implemented to prevent the FMD spread nationally and the neighboring countries? It is clear from the OIE manual that the FMD is not just spread from animal to animal, but can spread by contact with surfaces that are contaminated, and humans can be vectors. Thus, checking animals at auction grounds is very limited in effectiveness. Are there any spray down, foot bath, or fumigation practices implemented at the international borders and at the provincial borders? And how far is the implementation of the LIT system to control the movement of the animals?
You see, this is now where the National Animal Health Forum comes in, and the RPO comes in, the MPO comes in. They're all part of the National Animal Health Forum. There is a steering committee for foot and mouth disease, and we've got absolutely experts like Dr. Gideon Bruckner, who've just written a report for us. If I say for us, it's for the whole country, but it's for the National Animal Health Forum, and it's funded by the RPO, and it's just been released now. So a lot of things have been done. I have had contact, I'm not on that forum. I have had contact with people over the country saying that the roadblocks are in place, which I'm very happy about. I've been in the Lowveld, and we had roadblocks when foot and mouth disease broke out at the toll gates, and you had to open your boot and they looked for meat and everything. I think, but I'm sure, with these big outbreaks that we've had now in feedlots, 50,000 animals, that things are going to happen. You know, it must come nearer to you, the disease, before we all work together. And I hear what you're saying, and we've discussed this, roadblocks, police, everything, testing animals, the APAC guys, Francois Knowles, they're doing their job. But the problem is with these guys with little trailers, with cattle at the back, not tested, illegal movements at night. And I've just traveled now from Smithfield, and I see more and more and more cameras at T-junctions. So yeah, we're slowly coming there. But it's not perfect. And that's why I'm pleading, if you have anything to add to work together in your area, just do it. It's for us, it's for our survival of our industry. But contact Chris van Dijk if you have any things that you can add. Come and help us. Take your area and talk in farmers' days, and yeah, we've all got to work together. You've got my email address, dokfaffa@Nashua Copier, India Sierra Papa, nashwaisp.co.za. Please contact me, but become involved. Help us, help the industry.
Okay, then one of the other students, so it's just a student number, I can't see the name, asked if the biological fly control program by the BISA, is it proven to be more effective than the conventional methods like fly traps?
You see, these little wasps, the pupa, infected pupa that you spread over your dung heaps and things like that, they work in summertime, né? So you've got to get some of these wasps. When you start with it, they will supply you free of charge after 2 weeks with another batch, or 2 batches or 3 batches, and then you've got to add it monthly. And these wasps, the population will build up. And I can tell you, we've got the other control as well, saromazine, that you can put onto your dung heap. But it's what I say, it's a natural control with the wasps. But you must be careful. If you use insecticides, you kill the little wasps as well. So yeah, I can give you Dr. Eben de Pree's number as well. He's been using it at feedlots. So I just saw it with my own eyes I didn't see a fly in some of the